afternoon, everyone. Thank you so much for joining us today so promptly. My name is Danielle Fletcher, and I am the Communications and Outreach Coordinator for NAMI Maryland, and I'll be assisting with today's advocacy webinar. Before we get started, we just wanted to note a few housekeeping points. To avoid background noise, all participants will be muted for the duration of the webinar. We'll address questions at the end, so if you have any questions as the webinar continues, please enter them in the questions box, which is located on the right-hand side of your screen if you're viewing from a computer, or at the bottom or top of your screen if you're viewing from a phone. If you have any comments or concerns during the webinar, please also enter these into the questions box. We'll review and address any immediate needs as they occur. A recording of this advocacy webinar will be emailed to each registrant tomorrow. The recording will also be available on our website at www.namimd.org for any individuals who were unable to register or attend today. And now I'd like to hand it over to Maura Cyphers.
Awesome. Good afternoon. Thank you so much, Danielle. And welcome everyone. It seems like we've got a few more attendees signing on as we're getting started, but welcome to the 2022 NAMI Maryland Legislative Session Preview. I'm Maura Cyphers. I'm NAMI's Policy and Advocacy Consultant. If you haven't met me or interacted with me, I started out a million years ago as a volunteer with NAMI Maryland when I was staff over in the State House, and so over the years I've really enjoyed working with NAMI and staff, and so big thank you, shout out to Kate and Danielle and Deanna and everyone at NAMI for making this webinar possible today. And thank you to you, our attendees who are joining remotely or viewing this after hours. I know NAMI does record and post all of their webinars, so if there are folks who can't join, please feel free to share after the fact. One thing I do want to say too is that just as the NAMI Maryland grassroots, you're critical to accomplishing our public policy priorities, and we're all grateful to your passion, for your passion and for your willingness to advocate for yourselves and your loved ones. It makes a difference and a powerful one. So as we get started, let me flip to my slideshow. I want to spend a little bit time and provide some brief background on how NAMI does advocacy. And really, we start with a team approach. And so that's Kate Farrenholt, NAMI Maryland's executive director, her staff. And then on our side of things, Maura Cyphers, Josh Howe, and Addison Pruitt with Compass Government Relations. We help on a variety of policy and advocacy duties year-round. And so that's, helping staff Kate for specific, state-appointed boards and commission. That's, of course, legislative session, state regulatory matters. So it's sort of a jack of all trades, and we're here as a resource and to support NAMI Maryland, their work and their staff, and are always available for questions and working with local affiliates. And then the NAMI Maryland Board of Directors, the Policy and Advocacy Committee are critical to our work. This year, our Policy and Advocacy Committee is being led by Linda Weinberg and Sarah Weissman. We really appreciate the time and dedication that they've already put into helping us rework the platform and updating our annual priorities. It's a big job. It's a pretty big time commitment, and so it's great to have good leadership in that realm. And then our affiliate leaders, their advocacy liaisons. Every session, you guys provide a lot of great testimony. You help us flag bills and other legislation, and there is a lot of support and I think good advocacy work coming out of NAMI's 11 county affiliates. And then of course, NAMI grassroots. I think without you and without your relationships and without your lived experience in helping us, I think, illustrate these issues, which can kind of be conceptually tough to discuss, and putting a real life face on it is so important. So moving along, just want to make sure there's enough time for questions, and like Danielle said, we'll answer them, but really the focus of this webinar is session, and we'll be focusing on the next 4 months of legislative session. And I want to talk about a little bit about what NAMI Maryland does during session. Again, this year, due to the pandemic and the Omicron variant, we're looking at a lot of virtual advocacy, including Advocacy Day. So that will be virtual. There may be some opportunity for in-person advocacy later on in session. It's sort of TBD. We'll see how it goes. But if you're on here and you didn't attend Virtual Advocacy Day last year, please join us this year. Went really well. A note about that is we're scheduling Advocacy Day a little on the early side, and the hope is that folks can build on those relationships, have a solid base of education and knowledge about what the bills are, what the issues are going into session, and then can help when we've got action alerts or additional testimony, and really being involved in the process from the outset. I think we could anticipate between 2,500 and 3,000 bills introduced over the course of the 90-day session. If legislation is introduced on time, it's guaranteed a hearing. Not every bill is guaranteed a vote, but it's a fair amount of work. And so as, kind of as NAMI's role and what we're doing on NAMI's behalf and in coordination with staff is working with legislators on bill introductions, reviewing all bill introductions, monitoring, proposing amendments. NAMI rarely ever comes in as opposed, unless the bill is super harmful. We try to work very closely with legislators to amend bills or to get them withdrawn. But creating opportunities for grassroots engagement, already talked about Advocacy Day a little bit, action alerts, and supplying the language for calls or tweets or emails or however you want to get in touch with their legislators, testifying at hearings, writing testimony, editing, signups, all the logistics, and then assisting on local priorities. And I'll stop there really quick. I want to give a shout out to a couple of our local affiliates. NAMI MC has taken some initiative. I know they've testified recently before the Lieutenant Governor's Commission and before the state delegation, the Montgomery County delegation. They hear state priorities before they head to Annapolis for session. NAMI Howard County has been doing active outreach to some newly elected legislators in their area and continuing to strengthen their existing relationships. NAMI Prince George's has been working with local stakeholders and I think the county government on crisis response plan. NAMI Metro, always very involved with their local behavioral health authority and working on a number of programs. So there's a lot of advocacy crossover, policy crossover, and I think wanted to highlight it because our focus as NAMI Maryland is what's going on statewide, but the county affiliates really help continue that work and expand upon what we're able to do policy-wise at the state level. We testify on the state operating budget. We collaborate closely with coalition partners. I think if you've been on any webinar or get our weekly email updates during session, we work really closely with Behavioral Health System Baltimore. We're serving on the GBRICS Policy Committee, the Behavioral Health Coalition, the Children's Behavioral Health Coalition, the Behavioral Health Criminal Justice Partnership. We work with a wide array of provider organizations, other nonprofits, and other grassroots groups to really, I think, help join voices and enhance our priorities where we can. And all of that means really we can expand our reach and capacity. And so last year, 2021, virtually we offered testimony, I think, at more than 50 bill hearings and monitored 100 plus bills that were healthcare, behavioral health, criminal justice, justice involvement related for the most part. Let me move to my next slide. So how do we figure out what to work on? Periodic policy and advocacy surveys. So making sure that we are centering the grassroots which guide our work. Legislative coalitions. So if someone brings an idea to us, we bring an idea to them, and together we're collaborating on bills and improving policy outcomes statewide. Legislator ideas, we have a number of strong partnerships with policymakers, and they bring ideas to NAMI, or NAMI brings ideas to them, and we move ahead on leading on some major legislative reforms. And then national movements. So whether it's current events, expertise and guidance from NAMI National, there's a wide array of, okay, what are we going to work on and how are we going to do it? And so I think if you have an idea, if you've heard of a bill, give us a call, let us know, because it's always really helpful to, I think, have that ongoing conversation and support. And then, so resources, I think folks have mostly come to know and expect a handful of the same. The NAMI public policy platform, that's a living document. It's a record of pretty much any NAMI Maryland public policy position. It has been reworked for better clarity of reading. We do say it's a living document because the language isn't always consistent, and it's more of a comprehensive statement of values and policy positions rather than a lot of rationale. It's based on nationals. I think NAMI Maryland's is approaching 10 or 11 pages. Nationals is 75 plus. So NAMI.org has the National Public Policy Platform. NAMIMaryland.org has the Public Policy Platform. NAMI Maryland's is reviewed, discussed, and approved by the Public Policy and Advocacy Committee and the Board of Directors every year. So there's a lot of oversight that goes on in that regard. And then the NAMI Maryland priorities, those change year to year. The goal is to reflect specific topical focus. And I think seeking both documents out will help you have a good foundation. We're focusing today mostly on priorities because going to session, those are the large issue areas where in NAMI Maryland will primarily work. Now, if something comes up and it is right in line with NAMI Maryland's values, but for some reason is not part of the priorities, there's an approval process, but it doesn't preclude us from working on an issue. And that's sort of the fun and challenging thing about legislative session is while you can't predict what's going to come up, it also is an annual opportunity to very quickly address, or right wrongs, as the case may be. Okay, so yeah, I seen a couple questions come in. I want to just make sure we get through briefing everyone on NAMI's 2022 priorities first. So just make sure your questions are going in the chat and we'll respond. So here we go. What do we got next? Here are our priorities for 2022. They should look pretty familiar for the most part. I like to think of them as the foundation from which we build every year. So our first one, early intervention. I'll just scroll right on down, but I think these are probably facts and backgrounds that any family member knows, but early intervention treatment are essential. Half of all mental illness begins by age 14 and 75% by age 24. So it's critical that NAMI Maryland's not only promoting greater awareness and early identification of mental health conditions in youth, but we know that children and youth with mental illness need more support in Maryland, and that's not just at-risk youth, but it's every kid today. The need for services for this younger population continues to grow, and we've made great strides in some initial investments, but really without the workforce and then the community supports behind it, we're going to continue to have gaps that remain. So, I think there are close to 60,000 Marylanders who are aged 12 to 17 who were unable to access treatment for depression last year. There's a lack of crisis services in many parts of the state, and there have been some regional efforts and some statewide investments to address that. And then most of the kids who are justice involved or in the care of juvenile services have a mental illness. And so we've got priorities on early intervention, and I think what you could expect us to be working on, and before the end of the call, I'll share what I already know exists and what we have been working on through the fall, but expanding mental health services, K-12, public schools and higher ed, fighting stigma always, youth policy involvement, so making sure that youth are as involved as possible from the beginning. So if we're working on prevention programs or other state investment, that we're centering their voices and getting their feedback and making sure there's buy-in, right? You don't want to spend $30 million on something that kids aren't going to use. Increased inpatient and outpatient treatment access. The lack of inpatient treatment is an ongoing and critical problem in Maryland. Better caregiver support and housing and employment programs for youth. And then I think you'll see sort of second, and these priorities aren't in any sort of priority order. This is, a NAMI Maryland sort of perennial one, which is access to treatment and services. Mental health conditions in Maryland are really common. NAMI, I think it should be on NAMI Maryland's website, but NAMI Maryland periodically updates, and we'll send it out as part of our advocacy toolkit, a Maryland specific infographic and data page. And, there's, I think, 250,000 adults in Maryland who were unable to access the mental health care they needed. And there are 1 million people in Maryland who live in a community that does not have enough mental health professionals. So when people aren't getting the care they need, their conditions worsen. That has significant lasting impacts, not just on the individual, but their family, their community. And that's, I think, really why you'll always see something about access and services. We, NAMI Maryland, our partners in the Behavioral Health Coalition, really need to be defending our space and pushing for more until we do have seamless, comprehensive, accessible behavioral health care and a behavioral health system that works for all Marylanders. And some of the topics that I think we anticipate working on in the coming year and years to come: access to health coverage. So Maryland has pretty good private pay insurance coverage. I think like 95% or more Marylanders have health insurance, but anyone on this call can tell you that doesn't mean anything when you don't have any kind of access to providers, or you are paying out of pocket for all your behavioral health services and just a $20 copay for anything that's happening below your neck. And so that's where really demanding parity compliance comes in. And then a fully funded public behavioral health system. The issues with Optum for the past 2 years have been myriad ongoing, sort of creating chaos, and I think really devoting a lot of time and resources to fixing what's like a technical billing problem when we were in the midst of a pandemic and needed a lot on, I think, the service provision side too. Peer workforce expansion. Peers are, I think, going to be just helping expand our reach and capacity when it comes to provision of services, but their lived experience and their ability to help folks navigate the system is so incredibly valuable. And so working to not only expand peer workforce, but also to get them some reimbursement is going to be a priority for NAMI. Supporting expansions, protecting expansions to telehealth, we really made that a priority last year, and I think have largely been successful in that realm. And so that's more just like quarterbacking and making sure that nothing's happening, or we're making appropriate investments in the kind of technology that reaches into underserved communities and makes sense for, the folks who need to utilize telehealth. And then, of course, housing and employment programs. And the next priority we're highlighting for 2022 is the reduction of racial health disparities. So racial health disparities exist in Maryland. We've been talking about them for several years. And I think the pandemic really only served to highlight that, but their workforce disparities where physicians and people of color are way underrepresented to the rates of uninsured. Hispanic people in Maryland, I think, are 5 times as likely to not have insurance as white people. And then when it comes to behavioral health, white people in Maryland are twice as likely as minority people to report ever having seen a health provider for a mental health problem. And that's really despite greater or equal mental health disorders in the population. And these are statistics from 2020. So this isn't like a historical problem. These are, you know, kind of daily consistent inequities that exist. And so we worked on legislation last year to pour in pretty much an immediate $60 million infusion into communities that are underserved. And I think it's just kind of reiterating on that front and making sure that people with mental illness deserve the treatment and respect and dignity and access to community services so that they can be successful in managing their mental health no matter where they live. And so that goes beyond and into inclusion, community supports, fighting discriminatory policies. And so the case is still that in underserved areas of the state, racial health disparities make accessing mental health services nearly impossible. And so that not only results in worse health outcomes for people with chronic conditions, but with substance use, mental health, and other co-occurring disorders. So we're looking at issues like greater behavioral health focus and health equity resource communities. That's the $60 million infusion into targeted underserved communities in Maryland. Physical and mental health integration, culturally competent providers. So are the providers who are accessible to a community, do they look like them? Do they speak the language? Do they understand the population they're serving? Social determinants of health, continuity of safety net programs. And then, excuse me, moving on to our fourth and final slide, I think along with access to services, this has been a consistent priority for NAMI Maryland over the years. So strengthening Maryland's mental health crisis response. Nationally, we continue to criminalize mental illness. 1 in 4 individuals with a serious mental illness will be arrested during their lives. It's an old statistic, but I think it's largely still true. You're twice as likely to start behavioral health treatment in criminal justice setting in Maryland than you are in a healthcare setting. We like to say, and we'll continue saying, that NAMI Maryland advocates for help, not handcuffs. And we believe that mental health emergencies deserve a mental health response. The criminalization of mental illness must stop, and diverting justice-involved individuals to a healthcare setting is critical to supporting this work. There's going to be a lot of focus this session on 988 implementation and funding, continuing our, beating the drum on reducing law enforcement presence in crisis response, suicide prevention, Medicaid and insurance coverage for crisis services, a strong, connected crisis service system, and modernizing the danger standard. So I think that's our priorities. It's sort of a summary of where these 4 subject areas we likely think they'll go. We have a solid idea of what's going to be introduced kind of under all 4 of these, and also where we have been working throughout the interim, whether it's been on developing new legislation, on budget items, or on implementing existing legislation. So I will spend a couple minutes on our 2022 priorities in action, and then we'll open it up for Q&A. But I think I just ran through what the 1 or 2 dozen policy ideas and priorities through NAMI's priorities: early intervention, improving access, reducing racial health disparities, and addressing increasing crisis services. And so some are in process, some are achievable in the near term, and some of these are a little pie in the sky, and so they'll require that foundational work and investment to meet some of these goals. But I think it's important to keep possibility in mind when we're talking about policy and advocacy in the mental health realm. And I think, like I mentioned earlier, we've been working with our partners, legislators, through the fall and early winter to get organized on a number of bills. And so I want to run through what's likely, and I think what you all can anticipate hearing about through email reports and additional webinars and action alerts in early 2022, and probably what we'll be talking about in prep for Advocacy Day. So under early intervention, prevention programs for youth. So I think we've got a report from the Department of Juvenile Services that basically says at-risk youth is, we need to ensure that we're setting the stage for greater state investment in addressing mental health issues early on. And I think these are the programs where we want to make sure they're youth involved from the get-go. Because if we're making those upfront investments and really doing what we need to address mental health needs in at-risk communities, the likelihood that these kids will become justice involved or require right now the sort of extreme interventions and supports that they do, which are frankly unsustainable and many times unattainable, will really go a long way. On investment for school-based services and providers, I think we're on the way there. If you've been on these calls in the past, we have talked about either, what's kind of known shorthand as Kerwin or the blueprint. It was historic landmark legislation to revamp our education funding, teacher training, school supports, and it included, I think, in the neighborhood of $300 million for school-based mental health services and community wraparound services. We are at the, I think, initial investment phase there. So I think probably 2 years in, there's one behavioral health provider for, I think, like every 375 kids. We need to get that number down to about 1 in 250. But the investments are going towards things like behavioral health coordinators for school systems, a division at MSDE that will focus on behavioral health, focusing on schools with high concentrations of poverty, and really, I think, strengthening the community-based wraparound services so that we can start closing some of the gaps in access that Maryland's kids face. Youth-focused crisis response, there's, I think it's pilot underway and some initial investment from the Hogan administration on some regional crisis response programs. And then the Children's Behavioral Health Coalition has been spending some time on improving voluntary placement agreements to make it easier for the kids and families who need intensive supports to access them. So we'll likely see some legislation on that front this session. Under access to treatment and services, legislation for peer reimbursement, I think, should be forthcoming. On parity, more supports for consumers, pushing again for network adequacy. That's really provider access. So where are the providers? What are the wait times? Who's accepting insurance? Figuring out what else can the state do on supports for out-of-pocket consumer costs. And then community behavioral health, certified community behavioral health center expansion. So let's get one in every county. Let's start regionally, but in the next 2 years, right, we want to have stronger community supports in place. And so I think, again, some initial investments been made, but advancing that and making sure that we're really reaching the communities which need mental health supports and services will be an ongoing priority. On reducing racial health disparities, career incentives, behavioral health workforce investment. I know the Baltimore City Delegation Chair, Delegate Stephanie Smith, is working on a bill. Anticipate NAMI will strongly support that'll help build capacity and create incentives for the minority behavioral health provider workforce. Robust implementation of the 21 legislation, I think I touched on earlier, but that investment into underserved health communities, making sure that behavioral health is a part of it. And then on strengthening our mental health crisis response. If you haven't already, you're going to start hearing a lot about 988. It's scheduled to go live nationally in July. And so it'll be a national number like 911 for the Suicide Prevention Lifeline. It'll provide 24/7 support, emotional support by phone, text, or chat to people in crisis and emotional distress. If people call 988, they will be routed to local behavioral health crisis centers where there'll be trained staff to provide supportive counseling and other resources connecting them to organizations like NAMI and our affiliates. So it's not just answering calls, it's about providing that connection to community mental health and substance use services at critical moments for people across Maryland. NAMI has been involved in a lot of the prep work over the last year. NAMI National has been coordinating kind of the state ledge response nationally, and then NAMI Maryland served with the Maryland Department of Health and a number of other stakeholders to help plan for 988 implementation. Funding, capacity, and coordination are sort of the top priorities there. The funding needed to increase call center capacity is in the 10+ million range. There should be, I think, 4 million coming from the supplemental mental health block grant. The state's got a pretty significant budget surplus because this has been an initiative led by the Department of Health. You know, I think it's fair to say that we can look to the Hogan administration for some upfront grant funding. But then how do we coordinate 988 and that implementation with other crisis services and initiatives, and also making sure that there's actually a comprehensive system of crisis services behind 988 to just back up that initial call line. And then beyond that, we've got 211 Press 1 to get connected to your local crisis call center. And so I think for the foreseeable future, 211 Press 1 will continue along with 988, but are these systems that will be rolled together? I think figuring out what that coordination is and clear communication between the two entities will be an ongoing priority. But basically, we're at the beginning of 988. There's a lot of work to go, and I think some probably mapping and assessments that needs to happen statewide to show where the gaps in available crisis services are. So what else? Oh, Medicaid insurance reimbursement for crisis services. I think that bill's already dropped, but that'll make their provision so much more affordable. And then, you know, we'll be looking to continue on our policy goals of reducing law enforcement involvement in crisis services. So that was a lot of information. Here are key dates and times. Please get on the NAMI mailing list. If you're not getting these, let me know. Make sure you're added to the distribution list. Join us for Advocacy Day. If you attended last year, I think it's always a little bit of a wild ride because the session schedule is always in flux, but we had some really meaningful conversations over Zoom, and I thought went surprisingly well. No snow cancellations because everyone can do it from the comfort of their home. So probably be about 8 a.m. to 1 p.m. some groups may have meetings between like 1 and 3, but very likely starting at 8 and wrapped up by 1 p.m. We'll be holding training webinar, have our virtual advocacy day, provide the crossover report. So that's a key deadline where we have a great sense of, okay, this bill is likely to pass, this bill is not likely to pass. And so giving everyone kind of a status update prior to the end of session and just making sure we're activating our grassroots so they can help lead on outreach. And then a week of near the end of session, you'll get the end of session report, and then we'll schedule a session wrap-up webinar. So look for our weekly Friday reports. We're putting together an advocacy toolkit. We'll provide background and one-pagers for things like mental health stats in Maryland, 988, and then always listing our bill priorities, so number, hearing date, sponsors, all of that. I think that's it. This is my contact info, and I'm happy to answer any questions.
And we have gotten a couple of questions, so I'll go ahead and read them off for you. First one is Lori asks, who are the major champions for mental health in the legislature?
That's a great question. A handful of people come to mind. Health and Government Operations Vice Chair Jocelyn Punya-Melnick. She is very cued into this. She, I believe, attended NAMI's education conference, very concerned about racial health disparities. Delegate Heather Bagnall, she has done a lot on youth access in that realm. Delegate Laura Charkoudian, she has done a lot on crisis services and reducing law enforcement involvement in that regard. Who else in the House? I mean, Delegate Pat Young. There's so many. There are a fair amount of really excellent advocates in the Senate. Senate Budget and Tax Committee Chairman Guy Gazzoni has been a key ally. Senate Finance Chair Dolores Kelly, she's been a friend to NAMI for many years. The Senate Finance Committee Vice Chair Brian Feldman, excellent, has, I think, sponsored bills for NAMI. We work with Senator Malcolm Augustine on probably 2 or 3 bills a session. Delegate Bonnie Cullison, Senator Craig Zucker. There's, I think, a wealth of advocates. And one thing that comes up occasionally, and it will come up during Advocacy Day, and we'll talk about it during the training, but you may have a legislator say, okay, well, I love you, but these issues don't come to my committee, so I don't want to sponsor your bill, or I'll do what I can when it gets to the floor. But the way the General Assembly works, it's very committee-based because there are so many bills. And so if you sit on a particular committee, you become kind of an immediate subject matter expert. So for NAMI, we spend a lot of time in Health and Government Operations and Senate Finance, which oversees health policy, and then House Judiciary and Senate Judicial Proceedings, which oversees sort of public safety and criminal justice. So those are where we find a lot of our champions, but frequently outside those committees too. But I would say don't be discouraged. It's unfortunately the nature of the institution that sometimes, especially for in the House, there's 141 members. They can weigh in and be as supportive as possible, but it's hard when you're not on the right committee. So I'll stop there with that one.
Awesome. Bob asks, is NAMI Maryland's PLC active and a collaborative partner with policy advocacy input?
Sorry, what?
Is NAMI Maryland's PLC active and a collaborative partner with policy advocacy input? That's what Bob asked.
I don't know what PLC is.
Maybe it's the policy advocacy committee is what he's talking about.
Oh,
if you can clarify in the chat, I can double check, but I think that's what he means.
Oh, okay. Yep. Our policy and advocacy committee is
Peer Leadership Council. I'm sorry. Thank you, Bob.
So when it comes to NAMI policy and advocacy, I'm an expert. NAMI programs, not so much. I'm sorry, I can't really speak to the peer leadership council aspect. We work closely with affiliates, their advocacy liaisons, and then the board, and the public policy and advocacy committee of the board. So I'm happy to, talk with staff internally and get you a response to your question.
So we'll move on. Stephanie asks, this was during the priorities section. Stephanie asked, what about increasing the number of providers accepting insurance? There's a serious lack of providers who accept insurance. And then access, I see access to health coverage, but what good is health coverage if no psychiatrists or therapists accept insurance?
Yeah, preaching to the choir. I can provide, I don't know, probably close to a half dozen bills we have worked on in the parity realm over the last 5-ish years to hold health insurers accountable. We now have a really strong partner in the Maryland Insurance Administration. They're, have created a reporting system and a rubric to help us identify parity violations and then hold insurers accountable. But I'll be completely honest, it's been so hard, and we have had a lot of, I think, creative ways, like I think trying to move away from single case agreements, or if a single case agreement is required, then it's, incumbent upon the insurer and the provider to figure out who's paying what, and the consumer should be held harmless. That got killed by the very powerful insurance lobby. It's tough. And I think everyone is aware of these issues, but it's, how do we kind of like break past the blockade and like stranglehold Care First and, the other private insurers have kind of on the Maryland legislature. We cannot get them to cooperate with the providers, but, then the providers are like, their measures are punitive. So it is tough to try to be the intermediary between these two parties in just what is a very long running dispute. But yes, what good is health insurance if they're not covering anything that they should be? And we've done stuff like eliminate mid-year formulary changes, which is great for keeping people on their meds. And it's small improvements like these that where we've been able to make some progress. And so hopefully working with the Parity Coalition on consumer advocacy tool to better help consumers advocate for their rights to their insurers and to the MIA to help hold insurance carriers accountable is really important. And so I think the MIA is going to help with, I think, some crackdown and monitoring of making sure that there's improved network adequacy and access to providers for private pay.
Awesome. Nova asks, will we receive information that's not on these slides, like how much money we're fighting for and other things that you've discussed?
Yep. Yeah, if you've not attended a NAMI Advocacy Day in the past, probably a week before, we try to put together all the information we've shared or what will be relevant for you to be sharing with legislators so you have time to review it. But there's talking points, there's bill summaries, there's a lot of in-depth details. Usually, the first webinar of session, we try to talk about, okay, here's what we do, here's how we do it, here's where the priorities are. But we have about a month until the bill introduction deadline closes. And so in that time, we will be shooting out bills and providing weekly bill summaries and educational opportunities for folks.
Awesome. And then Lori asked, are there any specific bills right now that you can tell us about?
Yep. I think we need to go through and kind of look at some of the language with Kate. So I look for our weekly report. The first one should come out on Friday, but I don't want to get kind of out over my skis until we've been able to go through. There are about 500 pre-files out right now, and probably 2,000 more will be introduced in the next month.
Awesome. I don't see any other questions currently, but Dawn just asked, Should we be concerned about funding for 988 implementation, or is the legislature likely to provide the necessary funding? Is NAMI Maryland participating in a statewide coalition here?
Yes, we are participating in a statewide coalition. We've been working really closely and have done presentations to the stakeholder group put together by the Maryland Department of Health on where our priorities are on 988. So yes, you can absolutely expect NAMI to be involved and help leading the charge. My understanding right now is that there are some like political realities we have to address, which is Governor Hogan has made investments in behavioral health, and the lieutenant governor has been a champion too. And so I think because his health department has been involved in moving ahead with the 988 implementation and has won some planning grants from SAMHSA to do so, that we'll likely see some support through grant funding because as a Republican, he has been for all 8 years very publicly resistant to raising fees. And so the federal government has authorized states to raise a specific fee on cell phone users that would go into a fund only to pay for 988. So I think we'll be establishing that trust fund, and we should have the funds that we need to move ahead with 988 from Governor Hogan, but then in future years, it will be actually enacting the fee to keep the program sustainable and to meet any anticipated growth needs there.
Marianne asks, how do we get the weekly report?
Go to NAMI's website and put in your email address, and then look for it from Danielle. If you're an affiliate leader, advocacy liaison, member of the board, those should also go directly to you through that distribution list also. But we'll, if you're not getting it, please let one of us know and we'll make sure you're on there. I occasionally unsubscribe. I keep unsubscribing to my kids' school emails, which is not good during the pandemic. So.
And if for whatever reason you don't see it in your email box, it'll also be uploaded to the advocacy section of our website every week. So just keep an eye out. Do we have any other questions coming in? I don't see any currently.
Awesome. Well, I know we covered a lot of information. I hope this was helpful. Really appreciate you setting this up, Danielle, and thank you. I think we had almost 60 people on. That's great for the Thursday after New Year's. Everyone stay healthy and stay safe. Please be in touch. We want to be a resource. We want to make sure you're sort of armed as and ready as you want to be to help us do battle this session and advocate for NAMI and their priorities. So thanks again, and join us. Please register for our Advocacy Day and look forward to seeing you then.
Yeah, and I'll put that in the chat. And just a reminder, this webinar has been recorded. So if you know anybody in your network or somebody who couldn't make it today, it will be recorded and posted to our website and on our advocacy section of our website. And I will put the link to register for Advocacy Day in the chat once more, just in case you haven't seen it yet. Feel free to pass that around to others, and anybody else who might be interested in attending Advocacy Day. And yeah, we wish you a safe and healthy rest of your week. Don't hesitate to reach out to us through our website or by phone at 410-884-8691 if you need additional resources or support. Have a great rest of your day, everybody.
Bye, Danielle. Thanks.